So first of all, I would like to just a moment. Yeah, yeah. So myself, Dr. Gurunath Sawan. I'm heading the medical department in Samarth Life Sciences. So on behalf of Samarth Life Sciences, I would like to welcome you all once again and sparing your valuable time and showing the interest in the webinar. More than 100 people have joined, and that shows how much people are still interested in listening about COVID and about methylene blue. I am sure last 1.5 years there were thousands of webinar has been done, but what I always see whenever Dr. Golwalkar and Dr. Kakadia sir, Shah sir is there, the attendance keeps on pouring. So that's very great thing. To begin with, I think now past 1.5 year is over, and now we are very much aware, and still I can say still lot is known, but still a lot is unknown to us. uh, we Human race has really made a progress in developing the vaccines. Now even in India many people are vaccinated, but still there are certain amount of people who are not taking vaccine. They are not against the vaccine because of one or the other reason. We have seen that the drugs, now the targeted drugs are getting approved in the US as well as in India. So we have seen molnupiravir getting an emergency approval. But what's surprising is our medical community of many states, including our ICMR, somehow they're not supporting molnupiravir, and they are saying, a lot of data is still needed before we use molnupiravir, and we are in the third wave. So although the vaccination is there, we are prepared, the drugs are available, but what we get to know or what we understand is we should not put our guards down. Okay, just because the vaccination is going on and the drugs are available, I think that we should not put our guard down. And one of the important guard, and one of the important weapon that we have and we have witnessed in last 1.5 years is methylene blue. Okay, Dr. Golwalkar sir, Kakadia sir, and Shah sir, Ira ma'am will also join. They have treated thousands of patients with methylene blue, and it's always a pleasure when Kakadia sir gives a session, because every time he brings something new information about methylene blue, and that is the reason we thought this is the correct time to have a webinar, one I will say one refreshing webinar on methylene blue with the new updates on it. So with this, I would like to introduce our today's speaker, Dr. Jagdip Kakadia. Sir belong to Bhavnagar, Gujarat, India, and sir is eye surgeon since 1989. In last 32 years, he has done over 60,000 of eye surgeries. Many medical, surgical, and lens-related instrument research he has conducted. He has also patent in his name, and apart from his normal curriculum activity, he has written books also, and these books are very famous pan-India. I would like to introduce our panelist, Dr. Deepak Golwalkar. Sir is senior pulmonologist and practicing since last 42 years. He is in solo practice in Bhavnagar, Gujarat. He has treated thousands of multi-drug resistance and extended drug resistant TB patients with methylene blue since 2004. He has a great experience for treating over 300 patients, maybe now more than that. This is a little bit old slide I am reading, of swine flu with methylene blue since 2019, and he has successfully treated and still treating more than might be 10,000 of patients of COVID-19 with methylene blue. We will surely take his opinion and he about this third wave Omicron and methylene blue after a few minutes. I would like to thank Dr. Ramesh Shah also, who is our panelist, for joining today. Sir is eye surgeon since 1985. He is a cataract and LASIK expert, and has done thousands of eye surgeries and very rich experience in the medical research along with methylene blue. Uh, Ira ma'am will be joining in few minutes, I guess, because I cannot see ma'am. So once ma'am will come, I will just give a brief intro about ma'am. Ma'am is MBBS and senior family physician from Bhavnagar. She has treated and saved thousands of COVID patients with methylene blue. It's not only the patients she has saved, even the family members of the patients she has saved by putting them on methylene blue. And she is doing her practice. She's also give the teleconsultation. She also give the online consultation so that many lives can be saved from COVID. So with that note, I would like to hand over this session to Kakadia sir. Sir, over to you.
Thank you, Dr. Gurunath, Mr. Tandon, and Mr. Pranav Shah for inviting us again and organizing this webinar on methylene blue. Few missing links, the recent revelations which I have learned in connection with Dr. Golwalkar, sir. So, is my screen visible, sir?
Yes, sir.
Yeah. Yes, sir. Yes, sir.
Okay, fine. So, before we begin the actual talk, let us pay our deepest respect to Netaji Subhash Chandra Bose, whose birthday is today, 23rd January. It is 126th birthday of Netaji Bose, and it is celebrated all over India now since last 3 years as Parakram Day. And this is the very place which is a memorial inaugurated in 2018 by Mr. Narendra Modi, our beloved Prime Minister. This place is in Port Blair, and it is at this location on 30th December 1943, 5 years before the official independence which we got, where he first time raised the Indian tricolor and declared himself as the free citizen of India. So in my opinion, actually the independence began here, and this is at this location, 126 foot tall mast and a flag has been made into a memorial in Port Blair. Everyone of us, those who have not visited Andaman, I strongly recommend to visit at least once. For two reasons, especially one for visiting the memorial of Netaji Bose, first tricolor unfurling, and also to visit the cellular jail and the Savarkar Kotri, the cell in which Veer Savarkar was kept as a solo prisoner for more than 20 years in the Kalapani Saja. And with that, let us come to our today's topic. Dr. Golwalkar has been introduced. Dr. Shah has been introduced. We all know this is one of the recent function where luckily we all three were together after a long pause. We were meeting in various webinars, but physically and personally meeting Dr. R.C. Shah, myself and Dr. Golwalkar, we had a recent opportunity. Dr. Ira Shah has also been introduced, and myself also has been introduced. Thank you once again, Samarth Life Science, for bringing this topic and bringing up this webinar. The third wave has already arrived. We were, speculating since last 7 months, 8 months that the COVID is now gone from India. Third wave will come, will not come. There were so many opinions which were floating around from Dr. Guleria to various authorities, but ultimately it has come. We know that it is there and it's going to be there for another 1 month or so. The peak has still not come, it's going to come. The fourth wave is likely after 10 months in October 2022, and the fifth wave is likely after another 10 to 11 months in August 2023. In the first wave in all India in August 2020, the cases per day were 98,000. The second wave peak in April, May, the cases were 19,000 per day. In the third wave peak, it is most likely by mid-February, the estimates are that it would be 7.5 lakhs. It may be 7.5 lakhs even today. It's already 4 lakhs, nearly 3.8 lakhs today. But that's only those who have tested. Because this variant is not so virulent, so most of the patients are not testing. They are just considering it as a common cold. They are staying home, and in 5-6 days they get cured. So the numbers are actually, I believe, is 1/3 or 1/4 of the real number of cases. It is catching more. The younger age groups, the mortality will be lower, but the infectivity will be much higher and much faster. I've seen few cases wherein the patients, after coming in contact with a positive person, within 4 to 5 hours, has started developing nasal and pharyngeal symptoms. So the infection is so fast. And this Omicron is not the last variant, because it's all possible that there may be another variant. EHU is already a variant which is seen in France. There may be XY up to XYZ, or maybe even more than those variants. Because whenever a new virus jumps the species from animal to humans, it actually takes several years before it keeps on mutating and becomes a human kind of a virus. And this kind of pandemic must have occurred 10,000 years ago, when the common cold virus must have jumped from some animal species to humans. And a lot of people must have died in those days. And then gradually, over a period of generations, we all became used to it. So similarly, this new virus is not going to go very quickly. We cannot expect this pandemic to end before another 4 years, 5 years. It actually takes decades of variations and mutations and development of adaptive herd immunity in humans before we can call it as a humanized virus. So suppose if a virus comes after 6 months or 7 months, which is mutated, and that mutation is more deadly than Omicron, or even more deadly than Delta, then what? So we should know, we should actually investigate, and we should thoroughly understand what weapons, what short weapons we already have in our hands if a new variant, more deadly variant comes in the future. And there's another risk which is going on around in the world in more than 75 laboratories. And this risk is named as gain of function research, GOF research. Now, what is gain of function research? It is a genetic modification experiments on viruses other than the human viruses to modify the virus to achieve some purpose, some gainful purpose for the humans. For example, a wild animal virus can be modified to infect and extensively mass kill, say, certain insect. And this way, instead of using pesticides or chemicals, we can use gain-of-function modified viruses to kill pests or insects. Use virus as an insecticide. For example, locust or grasshopper, tinda jisko bolte hain, can be killed by or their population can be controlled by GOF-modified virus. Even malarial mosquito themselves can be killed by a virus which they will ingest. So this research, GOF research, is going on around the world in more than 75 laboratories. And gene therapy is entirely based on gain-of-function virus experiments. Because for modifying the human genes, you cannot, there is no instrument, or there's nothing like a Caesar that you splice or you cut the genes and insert new gene in the place of the defective gene. It is the virus which will work as a vector, as a carrier. It will take that gene and insert that gene into the nucleus of the human cells. So the entire gene therapy is done by modified virus. And gain of function was a very, very controlled research by the United States government. But in 2012, during the Obama administration, the ban on this research was lifted. And if you read a 2015, October 2015 published book, which is available on Amazon, about the gain of function research, you will be, you'll be scared that someday, like Wuhan's laboratory, if some other virus escapes from out of any one of these 75 research stations, there can be a second pandemic. There can be a second parallel pandemic. I mean, this research is so dangerous. It is more dangerous than atomic research or atomic bomb manufacturing. If you want to grasp what is gain of function research, I recommend to read this book, which is available on Amazon. And it was while this GOF research experiment, which was being carried out by Dr. Shi Jingli, who is the person responsible for escape of this virus, intentional or unintentional, at Wuhan Institute of Virology, that this pandemic started from this place, from this laboratory. So this is going to go on. This is not going to stop. And as long as the GOF research goes on, there is a very high chance that there will be new different viruses. Even in January 2018, WHO on its website had warned the international governments that there could be a next pandemic from any one of these viruses. So knowledge is the weapon. So we have to gain the knowledge in such a way that whatever virus comes, we should be able to fight and kick and kill it. We knew that very well in the last 2 years from Dr. Golwalkar that methylene blue is a highly oxidative drug which can oxidize any RNA virus, not just coronavirus, but any RNA virus. And we all are indebted and thankful to Dr. Golwalkar, who pioneered the methylene blue treatment for viral infection in 2009, for TB infection in 2004, and then for corona infection since March 2020. So, but I was seeing that there were few patients. In spite of taking methylene blue, they were still getting infected. There were some patients who were developing severe disease. So in my mind, I was always constantly thinking that in spite of the methylene blue being such a powerful drug, there is something, some individual factor or some absorption factor or some body response factor. There was something by which some of the patients were, escaping from under the guardianship of the methylene blue. And luckily in September, myself, Dr. Golwalkar sir, Dr. Shah, and Dr. Iraben, we were approached by Mr. Vijay Ranka, Mr. Bhandari, and Dr. Praveen. He is a kidney transplant surgeon based in Bangalore. All these three doctors are based in Bangalore. And they did a very innovative thing in collaboration with an American team of doctors. They formed a company named Foslight Wellness Private Limited, and they approached us that since, sir, you have treated so many, Dr. Golwalkar sir has treated more than 7,000, 8,000 patients with methylene, we would like to come and meet you. So we said, you are most welcome, it will be our pleasure. And to our happiness, they came to Bhavnagar and we had a very long discussion meeting at my hospital in Bhavnagar. And from them, we learned that their pioneering group, which is a group of 22 doctors and a few other scientists in USA, they have treated more than 2,000 patients in USA, all on OPD basis. And they had 100% cure rate and zero admissions, zero complications. So first, I was not ready to believe them. But then they presented the data and the entire research worksheet to us. And then we realized that we should explore and try to learn what they are doing differently from what we were doing with methylene blue. So we had a series of meetings with Dr. Golwalkar and this team. This is their website, Foslight. Foslight Wellness, it's a company based in Bangalore. And this was their study, which is in the process of publication. They treated more than 2,000. By now, it is more than 2,700. This is October data. They treated by October, they had treated more than 2,000 patients of Delta COVID variant in Mexico City and in California and in some other parts of the USA. The study was enrolling confirmed RT-PCR positive and symptomatic patient, mild, moderate, or some severe cases. 100% of them were treated on OPD basis. There was no admission. Few ICU patients were also treated, but they were already inside the hospital before they started the treatment. All these patients who were enrolled in the study were confirmed RT-PCR positive, and every day they did RT-PCR test for 9-10 days till they received 2 negative RT-PCRs consecutively, indicating symptomatic inflammatory markers as well as RT-PCR cure. And the results were astonishing. 70% of their patients became symptom-free and RT-PCR negative in 2.6 days. 90% of those patients were cured in 4 days. That means all inflammatory markers down to normal, RT-PCR negative, 2 times negative on 2 consecutive days. 95% were cured in 5 days. So 70% in 2.5 days, remaining 20% in another 2 days, 4 days. The remaining 5% in 5 days, and 100% were cured in 7 days. So out of 2,700 patients, not a single patient had an illness lasting more than 7 days. There was 0 admission and 0 mortality. And in the controlled arm of almost the same number of patients of the same age group, RT-PCR was negative after 9 to 24 days. The disease lasted for 9 to 14 days. 35% of these control group patients, they needed admission. 15% of them needed ICU. And whereas it was 0 mortality in methylene blue treated group, the mortality rate in this group was higher, but it was not known because they lost the track of those ICU patients. And I was so happy and so surprised to see this study and the results that I decided to go to USA and meet them and see what they're doing in person. So I took a flight in October and went to USA. The company who makes methylene blue preparation for these doctors group in USA is named as Sirovin. Dr. Ray DeFalco and Dr. Manish Shah. He's originally from Bombay, but settled in USA for the last 45 years. They are the owners of this pharma company. And I had a happy chance to be with them for a few days. And also Dr. Mark Benito and few other doctors in the team I had a chance to meet. And when I went there, this person in the center, he is the Olympic boxing champion who became boxing champion in 2021 Tokyo Olympic. And this boy got COVID infection and he was being treated by Dr. Mark Benito. And he came for a follow-up on 3rd day, and I could see myself that his RT-PCR was positive with 18 CT value, meaning a very high viral load 4 days before. And on the 4th day, that was in 3.6 days, he became negative. He became completely symptom-free. So I saw some of their patients. I even took a trial because they said that you have lived in the ward, I mean, amongst the patients, so you might also have got the virus. So let us give you also a prophylactic treatment. So I took the treatment myself also. And it was a very happy surprise for me to see their data and learn. from them what exactly was the difference. So they were actually working on two other diseases for last 5-6 years. They were treating the cases of severe HIV with methylene blue and photodynamic therapy, and also they were treating Lyme disease. Now, Lyme disease in USA is a viral infection or some kind of infection which is induced by tick. And that causes a gradual loss of energy and the function of the person. And gradually, over a period of next 15 to 20 years, the person becomes vegetative. So they were getting extraordinary results in Lyme disease, for which there is no other treatment in USA. And they are very popular therapists specifically for Lyme disease and for HIV. And when COVID came, they, same like Dr. Golwalkar, they also thought that if Lyme virus can be killed by methylene blue and photodynamic therapy, and if the HIV virus also can be extinguished by methylene blue, why not to try the same therapy on COVID patients? And they started getting excellent results. So that's how it began in USA. It was more or less like a parallel. We did not know each other. We did not know each other group work. But eventually, after several webinars, they had heard some of our webinars, and then they approached Dr. Golwalkar, and then they approached me. So the photodynamic therapy theory is that methylene blue is a dye which has a peak absorption at 670 nanometer in the visible spectrum of light. And if we expose methylene blue to this bright red light, the potency of the methylene blue activity, the redox potential of the methylene blue's activity goes up by almost 60 to 70 times. That means a 5 milligram dose would be potentiated to become as good as something like 300 to 350 milligrams dose. So that is what the difference, which was mainly they had found. And that's why with a very small dose, in a very, very quick fashion, they were able to inactivate the viruses and calm down the cytokine storm. So they had made this special device which would emit a particular wavelength of light, and the patient has to take methylene blue per oral 5 milligrams. Their concentration is 5 milligrams in 1 ml. So instead of 0.1%, which we were using here, they are using 0.5%, so that the volume is less. They've added some other minerals. They also have added something to make the methylene blue's very bitter taste into a sweet one. Now that is their proprietary this thing. But when you take this blue, methylene blue, feel, and they have added some rose and saffron kind of flavor. So when you take that 1 ml of 5 milligram methylene, you don't feel the bitterness on your tongue, and in fact you feel as if you are taking some kind of a soft drink. And this wristband will emit a particular wavelength of light, a particular watt of light, and when you keep it on the radial area of your arm, the radial artery and the ulnar artery, and the radial nerve and the ulnar nerve, both arteries and both nerves are covered under this light. So the blood, which is now containing methylene blue, because the red light therapy has to be started after about 20-25 minutes after taking methylene blue. By the time the methylene blue has gone from the mouth and stomach into the general circulation. So now what happens is that the entire methylene blue is passing through the radial artery, going into the end circulation, and it comes back through the radial vein and ulnar vein and goes back to the heart. So the methylene blue is twice activated by the light, and when you keep that wristband for 1 hour, 8 to 9 times the entire blood has circulated under that red light excitation, and that potentiates the methylene blue's potency, as I said, to about 70 times, 70 times, number one. Number two, they have added something to the methylene blue in such a way that that methylene blue does not get excreted in the urine up to 18 to 24 hours, which otherwise gets excreted in 8 to 12 hours. So the dose is once in 24 hours, taking 1 hour of light after taking methylene blue, 20 minutes gap. So then I was, I was so happy to see that the trade name in USA is Praxa Blue, and then I requested them that let's go to our Los Angeles Swaminarayan temple. So those doctors team came with me. They were also very happy that we would like to visit the temple. So we all went to the temple, and it was Sharad Purnima day. And this is the Praxa Blue put at the feet of Sri Swaminarayan Bhagwan in that temple. This is the well blue, which is now going to be made available very soon by Foslight company with their formulation. And this is the wristband, which is rechargeable with a battery so that it can emit the specific red light for 1 hour. And the wristband can be used by family members 1 hour after 1 hour after 1 hour. So even 5-6 family members can use the same wristband after disinfecting it with sanitizer or with UV light. I asked them about that till the time it is available in India, what can we do? So after discussion with them and getting some of their data, I realized that if we use 50-watt red light therapy light for 50 minutes after taking methylene blue, it will give the same effect. And this information I relate to Dr. Golwalkar sir, and I think Dr. Golwalkar sir has already started using red light therapy with methylene blue for many of his severe chest infection patients, not only COVID, but other infections also. Dr. Golwalkar sir will tell more about it. The other option for us is taking methylene blue and then sitting for 20 minutes in soft sunlight, because the soft sunlight at around 9 in the morning and at around 5 in the evening emits the same wavelength spectrum which excites methylene blue. So there are two advantages. One is you are taking the methylene blue excitation red light. You are also taking the UVA light from the sun. So both ways you are being helped. So just instead of taking only methylene blue plus soft sunlight, or methylene blue with 50-watt, 50 minutes red light therapy, will give a much faster and much better recovery with almost 0% failure rate. This is the bottle of well blue. A few other things which I learned during my travels to Andaman and to US and some of the islands was that the least chances of COVID infection or least chances of respiratory infections are amongst those who are living near the seacoast, who are working in the sunlight in salty water. Especially those who are doing surfing or those who are doing sea swimming or beach bathing. They have the least number of infection cases in the world compared to the general population. So it is the saline plus sunlight which is causing some kind of miraculous effect as a disinfectant. And this I explored a lot in last 4 months to 5 months, and I found that it works very, very well. And that Dr. Golwalkar is also of the same opinion that adding a hypertonic saline to methylene blue in the nebulization gives an extraordinarily good results, where methylene blue alone would be failing. Hypertonic saline with methylene blue gives extraordinary results, because hypertonic saline plus the solar UVA light, what happens is, by hypertonic saline, by osmotic gradient, it brings more water into the thick and dry mucus. And the mucus of the COVID, as we all know, is very plasticky. It's something like a Fevicol, like the cystic fibrosis patient's mucus, which wants to stick no matter how much the patient tries to cough, it does not come out. But when you add hypertonic saline, the hypertonic saline will start, because of the osmotic gradient, bringing the water, more and more water from the cell into the mucin, and the mucus becomes very fluidy. And the second day, or within 12 hours, the patient, they start expectorating. Also, the sunlight containing red and UVA light produces hydrogen peroxide and ozone in the epithelial cell. And hypertonic saline produces HOCl, that is hypochlorous acid, via MPO enzyme pathway, that is myeloprotease myeloprotease peroxidase. So what happens is that first the H2O is converted into H2O2. H2O2 itself is a disinfectant, and then adding more and more number of chlorine ions by the hypertonic saline, which will be added by MPO into H2O, it makes 2 HOCl. So H2O2 plus 2Cl will make 2 HOCl, and it is the hypochlorous acid which is the ultimate disinfectant in human body. Our entire immune system functions by the release of HOCl by our white blood cells to inactivate the microorganisms, be it virus, or be it fungus, or be it the bacteria. So that is how the hypertonic saline works as body's own producer of hydrogen peroxide and hypochlorous acid, as well as liquefying the mucus. There are a number of publications which have already come up. You can read some of these papers: inhibition of severe acute respiratory syndrome, coronavirus 2 replication by hypertonic saline solution in lung and kidney epithelial cells. This has been reported, this has been experimented and demonstrated. It really works so very well. So after reading all this literature regarding the beneficial effect of hypertonic saline, this is just a small experiment which I kept on doing at home, how to make 7% hypertonic saline. So if you take 14 grams of iodized salt and dissolve these 14 grams into 200 ml of clean mineral water, that will give you 7% hypertonic saline. And this hypertonic saline can be taken into your respiratory tract and the lower tract by a nebulizer. If you boil, again, the salt will remain behind, only the water will become vapor. So instead of boiling, which is the NAS or the steam inhalation, that's not really going to work. We have to have a cold nebulization either, or you do the gel native with hypertonic saline. But gel native will help only for the sinuses and for the nasal mucosa, not for the lungs mucosa. So hypertonic saline is extremely good. And if you don't want to prepare hypertonic saline at home, then it's very easy and very simple to get hypertonic saline as eye drops. For some eye conditions, known as pseudophakic bullous keratopathy, we use hypertonic saline eye drops, and it's freely available at any eye surgery. I mean, any eye clinic, nearby medical store, you will find sodium chloride 5% eye drops. So these eye drops are available as 10 ml. You just need 3 or 4 ml for nebulization. So instead of preparing at home, we can use, and there are several companies in India which makes hypertonic saline. Now, also a few things which I learned from these US doctors was about the beneficial effect of nano silver. We all know that it's a tradition in our society, not only our society, but all over the world, in every society, it's a tradition that whenever a child is born in a family, usually the relatives, they give for the newborn child a gift, which is usually a silver spoon and a silver bowl or silver glass. And the children up to the age of 5 to 7 years were usually traditionally being fed milk or fluid and the food, etc., from the silver vessels. So why was this? Because our ancestors knew that silver is an extremely potent antiviral, extremely potent antibacterial, and using the silver in the right fashion, in the right proportion, can really work as a drug. So after seeing those doctors using this also as modality, I explored this, and we all know that it's very, very beneficial to drink water from the silver loti kept overnight. And those families where they cannot afford the silver vessels, the tradition when I was young was that in copper vessels where the water will be filled, my grandmother used to put one silver coin, pure silver coin. And that silver coin would always be there in the matka, releasing the ionic silver into the water which we were drinking. And probably this silver was helping us when we were child to stay away from the frequent respiratory infections and gastrointestinal infection. And we also know that whenever a sweet is coated with a silver foil, there will be no fungus growth on these sweets for weeks together. But if you make the same sweet without the foil, for example, penda, it will start growing fungus on the surface of penda within 3 days or 4 days. But on Kaju Katri, the fungus will not grow because there is a silver foil. So silver has a great antibacterial effect, and this was probably known by our ancestors, and that's why they were using silver foil. Of course, now duplicate silver foils, aluminum foils are being used, but the real silver foil would prevent the sweets from getting rotten by fungus or by bacteria. And this principle of silver being an antibacterial antiviral was known even during the days of Ayurveda. And microorganisms, especially the virus, are negatively charged particles, and the silver being the positively charged particle, the virus would immediately get attracted to the nanosilver particles. It will stick over there, and once it has stuck to the nanosilver particle, the size of which would be 5 to 7 microns, 5 to 7 nanometers. And then the silver nanoparticles will start releasing silver ions, and the released silver ions will start destroying the envelope of the virus. The virus will be destroyed by silver. I would highly recommend all of you to download this book, The Colloidal Silver Handbook, which has been written by David Hooper. It's an excellent book of 23 pages, but it gives such rich information about the use of silver as an antiviral. You can download it from this website. And there are several papers which are worth reading about the use of silver nanoparticles on SARS-CoV-2, the potent antiviral effect of silver nanoparticles. This has been already published for last 1.5 years. This is another excellent paper by Dr. Subhashish Sarkar from Kolkata, who has done a lot of work on silver nanoparticles with bronchodilators through nebulization to treat COVID-19 patients. This can be read in details after downloading or printing it. The mechanisms of actions of silver is pretty similar to methylene blue. The silver ions released from silver nanoparticles form chemical compounds which are known as silver phosphide and silver sulfide with phospholipids and proteins of viral envelope, causing the envelope to be oxidized, causing multiple punctures, and the virus will become open. The genome will be destroyed. It denatures the viral spike protein and hence prevents the viral entry, and it prevents the re-entry of the virus. Those viruses which have already gone in, multiplied and they come out of the cells and they try to reinfect the second or nearby cells. So the entry is prevented for the new viruses and the re-entry is prevented from the already in viruses. The cytoplasm and the extracellular fluid is made into an alkaline medium which inhibits the viral replication, the same mechanism as methylene blue or hydroxychloroquine, and it reduces or prevents viral shedding in cough and sneeze. Because when you take colloidal silver as an inhalation through the nebulizer, it completely coats your mucosa of the respiratory tract. So whatever viruses are being shredded in your mucus or mucin secretion is again inactivated instantly by that silver. So when you are throwing the mucus or when you are sneezing, I mean, when the patient is sneezing, he is sneezing, but he is sneezing the inactivated dead viruses along with the nanosilver particles, which are also being shredded in the droplets. So silver, ionic silver or colloidal silver being taken as a nebulization is an excellent tool to prevent infection amongst the family members. If one person is positive, it will stop spreading to the other persons in the family. And the colloidal silver for lung disease in cystic fibrosis. This paper is also worth reading by Dr. V.R. Baral. And it's so simple and so easy to get it, because you get the miracle or true colloidal silver as 40 parts per million, 40 ppm concentration, 250 ml bottle for about 700 rupees on Amazon. And what we need is actually 10 ppm. So this 40 ppm can be diluted 1 gem4. So 250 ml will make almost like 1 liter of solution. That 1 liter of solution will last for almost a year for one family. So it's an excellent alternative which I have learned from these doctors who are using this in USA. It's available on Amazon from several companies. And this is the color chart. The size of the silver nanoparticle decides what color the fluid will be. What we want is 10 to 20 nanometer size. So when you order that, what you get is something like, haldi ka pani jaisa, yellowish color silver fluid. And also the color is decided by the concentration, how many ppm it is. So 100 ppm will be like reddish, 50 ppm will be like orangish, 20 ppm will be yellow, and 10 ppm will be pale yellow. And 10 ppm is the ideal dose. This is another paper by Dr. Oron Zakar, which is published. And he teaches in this paper, it's a 13-page paper, but he has so classically taught that for which virus, how much concentration of the nanosilver we would need and how to prepare it. So that's a very nice paper for us to go through. And what I have learned from Dr. Zakar's paper is that we need a 10 ppm solution. So for making 10 ppm, what we have to do is take 10 ml of the colloidal silver from this bottle into another amber color bottle, which is usually available from any perfume store. Any attar ka shop mein jayenge to aapko aisa empty bottles mil sakta hai. So you take 10 ml of colloidal silver, which is 40 ppm, and add 30 ml of distilled water. We have to use only distilled water, no other water, because other waters may contain magnesium and some other kind of metals, and those metals might reduce or alter the concentration of the colloidal silver. So colloidal silver can be diluted only in sterile distilled water, which is water for injection. So add 30 ml of water for injection to 10 ml of colloidal silver, and that will give us 10 ppm ready to use silver colloidal silver solution. We can get 10 ppm also, but it becomes a very bulky bottle and becomes more expensive to transport. The chances of breakage becomes higher. So 10 ppm of colloidal silver, 1 to 2 ml nebulization once in 10 days can prevent viral URI and LRI, because when you take the nano silver, it stays in the cells for 56 days. So for 56 days it stays. So for up to about 27 days, the half concentration is available. And for about 10 days, at least 70-80% of the concentration is available. So taking 1 ml or 2 ml nebulization of 10 ppm colloidal silver once in every 10 days can almost certainly prevent viral URI and LRI. That's what they are doing there in USA for all their cystic fibrosis patients from getting recurrent infection of normal common influenza. And 10 ppm colloidal silver, 1 ml nebulization once in a day for first 3 to 5 days. 1 ml per day for 3 to 5 days can cure any viral URI, LRI, not only viral, but even bacterial URI also. So cystic fibrotic patients, they are very prone to recurrent bacterial infection also, because they don't have a mechanism to expectorate and the lungs have developed cavities. So for those patients, they are using nano silver nebulization to prevent recurrent infection once in 10 days. So that was very nice piece of information which I got from them. 50% on the nano silver particles. There is a research paper which is published that 50% can be recovered up even after 56 days. I would strongly recommend these two books. One is by Dr. Gordon Pedersen and other is by Dr. Robert Torres, to read about colloidal silver miracle for health benefits as well as an antibiotic or antiviral. As there is an English proverb, however, no matter how dark it is, every cloud has a silver lining. And with that, I think I would like to conclude my presentation. Thank you very much with remembering the silver. I'll stop sharing my PowerPoint here and be open for discussion. Dr. Gurnath, thank you very much.
Thank you so much, Dr. Kakadia, for enlightening on the new therapies and new avenues which can be used for the treatment of COVID. I would like to request our panelists that if they have any questions, okay, we can have the questions right now. I also request audience, if they have any question, they can put it in the chat box, or you can just raise your hand and we will unmute you so that you can ask the question to Kakadia sir. So is there any question from the panel?
Dr. Kakadia?
Yes, sir.
What is the mode of metabolism of silver particles which goes to the lungs? As we know, in case of methylene fluid gets out of the kidney.
Right.
So can you explain the metabolism of?
See, the nanoparticle silvers which go in the lung or in the mucosa, they stay there for almost at 50-60 days. And there are some metabolic pathways in which silver is a component of the metabolism, and it becomes a part of that metabolism. So I don't know exactly how it gets excreted, or probably it does not get excreted, but it gets utilized in the enzymatic pathway wherever the silver molecules are being used as part of this.
Okay.
And silver bhasma, the Rajat bhasma, was also a very famous Ayurvedic therapy. There's a lot of importance being given in Ayurveda also on silver.
No, but silver is there in many of these tablets also. If you see the fine prints of many medicines, silver is added.
Right.
Not for now, many years.
Right, exactly.
One of the use of silver is medicinal use. And we are expecting acute shortage of silver in next 3 to 4 years.
Hmm.
And the prices of silver should go from 63,000 to around 2 lakh rupees a kg. That is
Oh.
what the prediction is. Because we
I-
have about 30% shortage of silver today.
Hmm.
And silver is not produced like gold. Silver is usually a byproduct of zinc and other things. So if you mine 14 tons of earth, you get 1 gram of silver.
RC, I feel like fully agreeing with you that silver will be in shortage, because when I met these doctors in California, they said that there are many patients. The doctors had full faith in methylene blue, but the patients did not have the faith in methylene blue. So there are many patients who opted out of methylene blue study. I said, why you took a control arm when you already knew that methylene blue is working? Even for AIDS, if it is working, it has to work on COVID. So they said it was not we who opted the patients out. The control group was actually those patients who themselves opted out of methylene blue. They were afraid of taking methylene blue because most of the people have some misconception about methylene blue. They really don't understand methylene blue in the right context. So they feel that their liver will be damaged, their kidney will be damaged, something, this, that thing will happen. So for those patients, they had another arm in which they were using silver, colloidal silver as an inhalation. And they were getting excellent result, almost at par with methylene blue. For whatever early stage of COVID, whatever benefits would methylene blue nebulization will give, the same benefits will be given by the colloidal silver being used as nebulization. And it's not a long, it's not an ingestion of several milligrams per day. It's in nanograms actually. So the argyria or the silver accumulation in the skin and the skin becoming blue over a period of 5-10 years of excessive ingestion of silver, that does not happen with such a small nebulized dosage. So Dr. Golwalkar, sir,
Yes.
this colloidal silver nebulization was a completely new information for me. So
Yeah, that is very good information. And what I was thinking that we can join together methylene blue with silver. That will be an excellent,
Right.
Whatever
Right.
methylene blue may be having
Huh.
will be fulfilled by the silver
Right.
particle also.
Right. So, sir, you already have joined 2 weapons, hypertonic saline and methylene blue. Now you join the third one, so it becomes a trishul.
Yes.
आपका वो क्या महादेव का त्रिशूल बन जाएगा सर, methyl blue, nano silver and hypertonic
The
saline.
only problem, Dr. Golwalkar, that silver should not react with methylene blue.
No, I'll give it separately.
Okay.
We
don't know whether it will
Not in-
react or not.
And that too, Dr. Kakadia said that it will work for 10 days. So once in 10 days, I would like to give. That way, nanoparticles. Methylene blue can be given regularly, but I would like to give it on 10th day only. Means when patient comes again, that time I can think of giving, because that's what I was thinking when I was listening to Dr. Kakadia. That will be done from tomorrow only.
Sir, I have some colloidal silver. I send it across to you.
Sure.
So you can start using it from tomorrow. It is.
Sir, yeah, sir, there is a, yeah.
This is the bottle of colloidal silver. And this is the color of the colloidal silver when you dilute it 1:10. Yeah, please, Dr. Guna.
Yeah.
You need
So
a
there is-
special bottle for this, the amber color, so that it can be protected from the sun, or it's a clean bottle will do.
No, it's an amber color bottle, because the nanoparticle silver is triturated and it is suspended as a colloidal in the colloidal form in the water. What I read in one of the paper was that the bright sunlight would precipitate the colloidal silver. So instead of remaining uniformly distributed throughout the water, as a colloidal phase, it will become a liquid and solid kind of a separation. So they always recommend to keep it in a dark corner in a amber color bottle, not to expose to too bright sunlight.
So there are a few questions from the audience. Can this silver therapy be given in children 3 to 10 years?
Yes, why not? I mean, in fact, the children are fed with a silver spoon the moment they are born. And if you recall, on all the noble families and in all the royal families, they always eat from the silver vessels. And that's the reason why the mortality before 1950 or before 1900 in the medieval time, the children mortality rate and the infectious disease rate amongst the royal families and amongst the noble families was much, much less compared to ordinary people who could not afford to eat in silver vessels. And that's why the English idiom born with the silver spoon. So if you are feeding your child a milk which is contained in a silver vessel with a silver spoon, you are already giving nano silver to that child. So there is no age limit. I mean, there's no lower age limit. It can be given at any age.
And sir, I'm sure from in nebulization also, if we don't know whether there is a reaction between silver and methylene blue. So I'm sure in nebulization also these two solutions is not recommended.
No. Methylene blue and nano silver do not have any interaction.
Okay.
There is no interaction.
So can we give it together?
Methylene blue is a neutral chemical. It is chloride salt of methylthioneine. So it does not have any potency. It is neither a positively charged molecule nor a negatively charged molecule. So it does not attract the colloidal silver, because silver is a positively charged molecule. Methylene blue is like a sannyasi. It does not have any attraction or affinity for positive or negative. So it can be.
So, sir, in nebulization, it can be given.
It can be given. It can be. I mean, I don't have any evidence, or I don't have any proof, but from what organic chemistry I know of, there is no interaction, there is no precipitation. It can be given. But suppose, as Dr. Golwalkar said, initially, if you don't want to take that chance, then you give 1 ml of methylene blue nebulization. Once that is over, add the silver in the cup. Methylene blue and salt, hypertonic saline can be combined. That we have found out. Dr. Golwalkar sir was initially giving it as 2 separate things. When he started, he was giving it separate, but later on we realized that it can be combined.
Sir, kuch dikha rahe.
Silver glass. Sir, you are muted. Sir, unmute kariye sir aapka mic.
My granddaughter drinks water through this with this silver glass only. Even today.
That's great. That's great. I remember when I was a young child, my grandmother used to put a silver coin every night in the water matka. 2-3 silver coins she would put. So the main point was we should open our mind to colloidal silver as well as the benefits of hypertonic saline as well, and use all the 3 weapons which are available to us as best as possible, as wisely as possible. And suppose if somebody has a reservation in mind about methylene blue, there are 2 other weapons. So it gives us a broader spectrum of weaponry.
I think many of these.
Sorry, please, sir.
Many of these pediatricians give this on normal saline nebulizer for upper respiratory tract infections in Bombay, at least. I have seen many of these pediatricians give nebulizer of normal saline.
Normal or hypertonic?
I think it is hypertonic.
Hypertonic.
It's normal doesn't work.
Yeah, normal will not work well. Hypertonic will definitely work.
Hypertonic saline they are officially giving in Mumbai. I don't know about the rest.
Sir, there is a question from audience. Is there any guideline support for this therapy, and are there any contraindication to this silver therapy?
I think we need to have another webinar for that. But the guideline which I have found from the papers which I have read and from the doctors who are using in USA, they are even using it for burns dressing. They are using for scratch wounds, various kinds of infectious disease. Even I saw them using nanosilver nebulization for Pseudomonas infection. Sir, Golwalkar sir, Pseudomonas infection in lungs in a patient who had a severe cystic fibrosis. They were using methylene blue and nanosilver and hypertonic saline, all the three nebulization as a part of the therapy, because on Pseudomonas aeruginosa, which was infecting the cystic fibrotic lungs of those patients, who are not coming under control with meropenem or vancomycin or whatever. So then they gave this, and they told me the patients are getting cured very quickly with this. I also saw them using methylene blue and nanosilver after the hip transplant, total hip transplant surgery being sprayed on the hip joint which they have implanted. Before they close the suture, they would spray this methylene blue and nanosilver on the hip joint to prevent the hospital induced MRSA, methicillin resistant Staph aureus infection, which was pretty common from the orthopedic long surgeries, 7-8 hours long surgeries. They were getting this MRSA infection. So they found that using this in the wound soon after the implantation of the joint, they started getting zero infection.
Dr. Kakadia, can we request Samar to make the nanosilver eye drops?
Yes, we can, certainly.
Sure, sir. We will definitely look into it.
Because any mucosal cell will grasp the nanoparticle and hold it. So if the respiratory mucosa holds, the conjunctiva should also hold. So yes, we can. We request. We openly request. Publicly request.
What percentage will become isotonic of nanosilver? Let me ask you this question.
Not isotonic. No, isotonic is for saline, RC.
No. When suppose we prepare the drops from this solution which is available, 40 ppm.
There are number of papers which indicates that if it is more than 10 ppm, it becomes highly irritant for the mucosal cells, for the respiratory mucosal cell. I haven't come across any study for conjunctival mucosal cell, but respiratory mucosal cell does not tolerate more than 10 ppm. And the virucidal effect of nanosilver is achieved at 4 ppm. Bactericidal effect and fungicidal effect is achieved at 10 ppm. So they are using 10 ppm.
What is the shelf life of this solution?
They mention here 24 months.
Why I'm asking you is that why can't we make these drops?
We can. We will do that.
That is why what I'm asking you, because of what isotonicity and all these questions were there for in relation to making these drops.
I understand. We'll start doing this for the conjunctivitis and for the
we have already used methylene blue.
Right, exactly. We'll do that. We'll do that. And once we get a primary success with this self-made eye drops, we'll ask Samar Pharma to make a batch of 1,000, 2,000 eye drops.
The one more thing is that we are using amoxicillin inside the eye to prevent the infection which is there. Why can't we think about this inside the eye? It's just a thought.
We don't know whether it will cause iritis or not. We'll work out that. We'll do some animal studies.
And this is just a thinking which I'm telling.
Yeah. You always have out of the box thinking.
I think there was one request for method of taking silver. So I request Mr. Rathod and anyone who wants to listen to this presentation one more time. The presentation will be on YouTube. We will shortly put the Doc Academy, that is our Summers channel, on this chat box, and you can go anytime and you can listen to this session as many times as you want. Sir, obviously we have talked much about the silver therapy and this thing, but let me go a little back and let's talk about a few minutes about this Omicron. So I would like to ask few questions to our panelists, that what the difference in symptoms you see between the Omicron and Delta, and is there any classical symptom of Omicron? Golwalkar sir.
No, there are no any classical symptoms. I've been observing, I must have seen up till now, at least not confirmed, but because we don't have any facilities for the Omicron, but they have some fever for a day and that goes away. But on fourth day, they feel some weakness, so they get checked up and they come to know that they have RT-PCR is positive. And they don't come with major symptoms. But one thing I would like to share, I've about 65 patients I have examined in the last 10 days. 2 have come with Delta picture. Yesterday, one lady came with 73% oxygen saturation. 8 days back, one had some doubtful region in the lungs. So I asked for the 20-meter walk test and it came down from 95 to 87. So we are not totally safe from, means we cannot ignore that Delta has gone.
Right.
Yeah.
Very correct.
And second thing, I'm specifically asking everybody, have you taken vaccine? Most of them have taken second dose of vaccine. Yesterday, one person had come with booster dose and he was positive. So this is totally different. Means Delta has nothing to do. Yesterday one patient came. He had twice Delta infection and yesterday he was RT-PCR positive, but no pulmonary lesion. That is the thing I had observed. Second thing, it is restricted to the mouth and nose only. So I was thinking that UV light along with methylene blue should be very helpful in protecting, because it is not going inside, and vaccination or Delta infection are not protecting him. Methylene blue must be playing a good role, because I am still protected. My staff is protected. Those who are taking regularly, they are still protected. Person says that I'm taking methylene blue, but when specifically asking him, he said that yes, 10 days I stopped taking it. Now after the infect fever, he started taking it again. So they are not very regular because there was no infection in between. So they have got bottles lying in since 6 months, 8 months. I got a bottle. I started using moment I got temperature. So methylene blue is not protecting. I will not agree, but they are not regular in taking it. You have to take it regularly. That is one thing I would. And UV light and methylene blue regular, I am sure will 100% protect from any Omicron also.
Right. Sir, how significant is RT-PCR positivity? It is genuinely important to find out whether they are infected, not infected.
Well, we have to believe it. Otherwise, Dr. Kakadia had said that genomes also will give positivity. Means even if person takes methylene blue, symptomatically it doesn't have any symptoms, but genome also will give positivity. So, but we cannot take chances, because as I said, 2 patients had come with Delta picture. Yesterday, one lady had come with 73% oxygen saturation. So I had to, and radiologically could be corroborated, and she was RT-PCR positive. So We don't want to take chances. Now, I am just thinking what difference is pathogenesis means this Omicron is not entering into the lung. Well, Delta was invariably entering into the lung. So pathogenicity of these two, where lies the difference? If we can find out that thing, it will be very helpful. One very good observation I've been thinking since a long time, that I was working in 750-bedded TB and chest hospital. Very rarely the workers working in the hospital got TB. Now, this is my observation. People working in TB rarely develop TB. Very few TB patients gets corona. So what I feel that the PPD nebulized form may offer better protection. That is my logical association is there, because I was working in 10 years in 750-bedded purely TB hospital exclusively, but I don't know any staff had developed, because most of the patients were AB positive, but rarely any one of them got TB. And this is my observation. Very few patients, I think I have not yet come across a TB patient coming with RT-PCR positive. So that will also be another way we can think of protecting with PPD in nebulized form may give you some better protection. That is what my observation is.
Ira ma'am, do you find any symptom difference in Delta and Omicron? Ma'am, you are on mute.
To date, in Omicron, we are not finding such severe symptoms, but we are finding certain patients with pulmonary symptoms, as Dr. Golwalkar said. So I always have to tell my patients, I do not know whether you have Omicron or Delta. So let's be careful when we manage. Another thing I wanted to find out from Dr. Golwalkar, Dr. Kakadia, and everybody else who is treating patients, what have they seen in the pattern of the CBC and CRP of these patients? Because I've been following up the CBC and the CRP of my patients, and I have got varied pictures this time. There are some patients who come with a neutrophilia and a lymphopenia as we got in Delta variant. Others are coming with monocytosis, especially the children, right? And some patients are coming with lymphocytosis. So we say that the virus is not penetrating. We say the virus is non-invasive, it is sitting in the nasopharynx. But does this mean that it is interacting with our immune system? Only then it can create a pyrogen. Only then it can give us fever. Only then it can give patient headache, myalgia, weakness. And those patients who are developing eosinophilia, their symptoms are only getting relieved if I give them ivermectin or hetrazan. Otherwise, the cough persists. Now, I am totally on an unscientific platform, but these are the results I'm getting. So I want those people who are doing scientific work with plenty of patients, what is their experience?
Sir, any answer to that question? Golwalkar sir?
Not from me, but Dr. Golwalkar sir can.
Yeah. I think, sir, the internet connection is poor from Golwalkar sir.
Yeah.
Yeah, because
No, I have not noticed much difference, but we'll keep an eye on that thing also. But otherwise, they come with one very short history and it doesn't persist, or rather I give full attack because I have to take any chances, but they keep on, I think, that particular thing. Whether snake is poisonous or non-poisonous, I don't want to take any chances. So I treat every patient like a poisonous snake and that go on attacking him. So keep an eye on that. And as I was giving it now.
Okay. Okay. Sir, what about the children? Is this current wave affecting the children? Because obviously they are unvaccinated.
One 4-year-old girl had come, her family was infected and she had come with RT-PCR positive. 4-year-old, first time. 7 days back, a 4-year-old girl had come with RT-PCR. That first time I saw a girl. I treated her and she got cured. But first time I saw a girl, 4-year-old child.
Sir, unfortunately, the network bandwidth is low from your side, so there is a lot of breaking in the voice. Ira ma'am, can you please answer that question, because we could hear a little bit from sir. So, are the children getting affected because of the Omicron?
The youngest child I have treated was 6 years old.
Okay.
And yes, I have seen children, because when a family gets infected, after a couple of days, the children also have symptoms. And some of them are coming up with gastroenteritis instead of the cold and cough. The cold and cough goes. We thought it was because of the cold weather that they were sniveling. But then they came with abdominal pain, vomiting, and diarrhea for 2 days. And I treated them because the other members of the family also were positive, and they are doing well now. They are absolutely normal.
Okay. One question to Kakadia sir as well as Golwalkar sir. So, sir, do we need to give the same dosage for the Omicron for the methylene blue, or do we need to modify the dosage for Omicron?
No, this is the minimal dose, so we can continue with the same. I'm continuing with the same doses.
Okay.
Less than that, continuing with the same doses.
Okay. 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 Fine.
Since
I found that
ma'am, go ahead.
Good.
Oral methylene blue was not helping so much as nebulization both the times.
Right.
So contacts of the patients, I started nebulizing with the hypertonic saline, and they could escape the infection. They did not become RT-PCR positive.
Right, that's correct.
Okay.
Right.
Kakadia sir, you were saying something.
Yeah. So I was almost saying the same thing which Dr. Yabin was saying and Dr. Golwalkar was saying. See, the first thing we have to understand is that methylene blue is an oxidizer of the virus, of any RNA virus. Any virus which is enveloped in a lipid protein shell will be oxidized. So methylene blue has no respect, no identity for any variant, because variant is variation in the RNA sequence. So how the RNA will replicate the virus and what kind of surface proteins it will manifest. But methylene blue has nothing to do with it. It's something like when you take a soap water, it will emulsify the virus, whatever variant, the soap water will emulsify the virus, or 75% plus isopropyl alcohol will denature and liquefy the virus. Same way methylene blue will liquefy. So the dose which was effective against Delta also would be same effective against the Omicron. But the difference between Omicron and Delta is that, number one, Omicron is extremely infectious. I have seen contact persons of a positive person within my family. I have seen within my cousins and me, within 5 hours of coming in contact with one person who had a sneezing, the other person started developing sneezing. He came from Surat. Here he came in contact. So when he came from the Surat, he knew that he was completely healthy. Within 5 to 6 hours of coming in contact with one person positive, he started developing susurhat in the nose. He started feeling that there's something has started in the nose. So it's very, very fast setting up of the infection. Luckily, it does not go beyond the voice box. It remains above the voice box. So it's COVID coryza more rather than COVID pneumonia with Omicron. But for the coryzal infection, nebulization is definitely much better because when you take 5 ml oral, it gets diluted all over the blood and the concentration which is there in the mucosa is not as much as when you take 5 ml straight in the mucosa. The concentration when you take nebulization would be almost like, I would believe, 100 times more per cell concentration than when it is taken per oral. So definitely, I fully agree with Dr. Golwalkar that nebulization of 4 or 5 ml of methylene will be much more protective than taking per oral.
I think Dr. Venkatraman has raised his hand. Sir, Dr. Venkatraman, if you have any question, you can just unmute and ask. No problem. Okay, fine. So one more question to Kakadia, sir. Sir, Omicron is infecting even the fully vaccinated people. So
Right.
is the vaccination failing?
No. The vaccination is not failing. So we don't understand our immune system as a general, and we don't understand the vaccination also in a proper light or proper fashion. Can I show one small PowerPoint? Few slides about
Yes,
to
yes,
answer,
sir.
answer this
Yes, sir. Yes.
question. Allow me to share the screen.
Yeah.
Okay, so let us first understand our two immune systems. One is innate system and other is adaptive immune system. Now, innate immune system is the one with which we are born. We are genetically inherited as humans from our ancestors. That is innate immune system. And the adaptive immune system is the one which is gradually learning during our lifetime that with whom to fight, how much to fight, whether to fight or whether not to fight. So what an innate immunity, which is an untrained, inherited or genetic immunity, what this will do is, let us say our adaptive immunity, our memory cell lymphocyte does not have any memory that this particular virus has ever entered our body. So the virus enters, starts growing and starts infecting the cells, the lung mucosal cells. Now these lung mucosal cells, our white blood cells are not able to identify the virus as a specific or inactivate the virus as specific. So what they try is they start killing the lung epithelial cells which are infected. So it's something like a very rough or untrained kind of our army. Suppose if there is a building like this, and in one of the flat, there are 10 terrorists who are hiding here. So what an untrained or improper military would do is it will start bombarding the entire building, destroy the 10 terrorists who are hiding here, but it will also destroy the entire building. It will also destroy the other civilians who are innocent outside. So that is the response of our innate immunity, which has not been trained. And this is what happens when we have not been trained. Our immune system has not been trained as an adaptive immunity to fight against a particular virus. So this is what was happening with Delta variant when the people were not vaccinated. The moment the infection starts, the innate immune cell will start fighting against those viruses. They cannot fight, so they will start destroying the entire cells. The entire lungs were being destroyed. And that's how the patient would go into a failure, respiratory failure, and then later on, multi-organ failure, which leads to apoptosis, which leads to cytokine storm, and then the sequence of it. But what if the same problem of this building having 10 terrorists hiding here, if this is given to say SPG or Black Cat Commando or US Marines or US Navy Marines, what they would do is they will first isolate that flat, they will remove, somehow gradually remove everybody out, and they will have weapons to target only this with minimum collateral damage. So that is what our adaptive immunity does. So compare the adaptive immunity to a very elite group of specially trained Black Cat commandos versus the ordinary mob who would start lynching. So let us imagine 4 scenarios of vaccination. See, the first scenario, so what vaccine does is the vaccine trains your adaptive immunity to identify the virus. Vaccine does not prevent the infection. It only prevents the undue response to the infection. The innate immune response to the infection is prevented by vaccine by starting an adaptive response. Let us take 4 scenarios. Number 1, let us say one person, he has no natural infection and he has no vaccination, and he gets the viral load. Let us imagine Delta, or even if he gets an Omicron, which is a less intense virus comparatively. But this person, if has no natural infection and no vaccination, he has very high chance of developing lung complications, solidification, secretion in the lung, developing pneumonia, pneumonitis. And because of untamed innate immunity, which does not know how to fight, whom to fight, they start fighting. So this is scenario number 1. Now the second scenario is that somebody has a natural infection, has luckily survived that infection in the past, but has not taken any vaccination afterwards. Now this person's adaptive immunity is well trained by the natural infection, which he has luckily survived. So the chances of complications are much less in this person. Now the third case scenario, where this person has no natural infection in the past ever in the last 2 years, but he has full vaccination. So his adaptive immunity is also trained like this person. Here it is the natural infection which has trained, here it is the synthetic infection which has trained, but he has very low chances of complications because adaptive immune system is trained, and innate immune response will remain silent because adaptive is going to respond. And the fourth scenario is that a person had vaccination and then the person had natural infection, or the person had natural infection and then he had full vaccination. Now in this situation, the adaptive immunity is maximally trained as best as it can be. So the chances of complications are the least, and the disease will be very short duration, very, very mild. So a person who has been vaccinated, and if he develops a secondary natural infection, he will have very, very less chance of going into complications, spending lakhs of rupees on ICU or on ventilator or oxygen therapy. He may not even need antiviral medication. He just needs a good sleep, good rest, paracetamol, and just general vitamins. So vaccination has not failed. We have failed to understand the vaccination. Vaccine works, vaccine tames, vaccine trains your immune system. It does not prevent the infection. So my take-home message is that take the vaccine as soon as possible. If you have not taken, please take booster dose once every 9 months for next 4 to 5 years, because the new variants are going to keep coming. The pandemic is not going to end by 5th February, as some astrologer has said. No, it's going to stay there for another few years. Even if you had 1 or 2 natural infections, taking vaccine is most advisable, because every time you take a synthetic or natural infection, you are training your adaptive immune memory cells better and better. All vaccines are effectively almost the same because they all are messenger RNA vaccine in one form or the other, except the co-vaccine, which is the whole virus, but which also gives the same response. Mix and match is not a problem at all. Vaccine complications are 1 in 1 million. whereas in unvaccinated, disease complications are 8 in 100. So risk of disease and complication is 1 lakh times higher than if you have taken vaccine. And disease is very expensive, almost costing 1 lakh to 5 lakh rupees, sometimes to 10 lakh rupees. And vaccine is free or almost for free. So vaccine is definitely advisable. Vaccine is not failing. Vaccine is successful. It is preventing. Imagine a situation at present in India, we are getting at least 15 lakh cases per day. 3.8 lakh cases are officially in ICMR database, everyday RT-PCR positive confirmed. There are equal number or 3 times equal number who do not get the test done because it's very mild disease. So out of 15 lakh disease, how many admissions we have seen in this wave? Hardly any. How many oxygen therapy we have seen in this? Very few. So the mildness of this wave and that we are not seeing the ambulances cheering with the cheering sounds around, or 8 hours of line of ambulances outside the civil hospitals is much, much more thanks to the vaccination. In last April, only healthcare workers were vaccinated. People were not vaccinated. That's why it was very severe death rate. But this time, the government has already vaccinated more than 80-85% of the population. So, and without vaccine, yesterday in Bhavnagar, we lost one 11-year boy from of school-going age. Now, suppose if this boy had a vaccine taken and his adaptive immunity was trained, he would not have developed a solidified lung and he would not have died. So definitely vaccine is an advantage and everybody must take it. And suppose if someone wants to take example of Dr. Golwalkar not taking the vaccine, then religiously, without missing a single dose, 2.5 ml in the morning, 2.5 ml nebulization in the evening before you go home. If you are not going to do that, don't take a chance.
I have to deal with these patients only nowadays.
Yes, sir. Please, sir, you are an ideal, but everybody does not follow the regime. You know, they start methylene blue for a few days, then they develop some tongue ulcer, some kind of stomatitis, they stop for 2 days, 3 days, 4 days, sometimes 5 days. Then they forget the bottle is somewhere in the cupboard, as you said. And after 15 days or 20 days, they become positive. फिर बोलते क्या है कि मिथिलीन ब्लू तो मैं ले रहा था फिर भी मुझे हुआ, बट तू 15 दिन से बंद कर दिया वो नहीं बोलेगा. It's exactly like some lady missing the
yes, that is the common history I get.
Right. Everywhere you will find the same history. And it's impossible for almost everybody to take methylene blue twice in a day, 12 hourly, religiously for 365 days without a single dose being missed, because methylene blue will give you protection only for 12 hours. So if we want to follow Dr. Golwalkar, we have to follow exactly and religiously.
So I think last time Dr. Golwalkar did say that he's acting as a guinea pig for himself and he's working amongst COVID patients. So doctor, you've been taking methylene blue for how many years now? 2 years continuously, regularly, daily?
No, not 2 years. There are other benefits. For that, I am taking since 3.5 years.
Right.
I am trying for another protection also.
Right.
And I am taking since 3.5 years.
Daily?
Yes, daily. Now, it's daily. Tell you my one experience, then I started thinking that when I was doing my graduation, one army personnel was climbing about 32 years. We don't expect TB to be there. So we got his X-ray test done, and there was a cavity, and he had hemoptysis. He never had any complaints or anything. So then we treated him, he got cured, everything was all right. But then I started thinking that we say that immunity and a healthy body, and it does give us better protection. But his body immune system is very good, but it was not trained to deal with tubercle bacilli. And he got the infection, he got a cavitation. Till then, he had hemoptysis, he was climbing a rock. So what I mean to say is that you have to train your body to deal with, like what I said, that TB patients, the people working in TB hospital, they have some special, I always ask my pathologist, take my bronchial secretion, do protein studies and see what is protecting me even from TB. I used to do rigid bronchoscopy when I was in that Amberga TB hospital. Now rigid bronchoscopy, you are like fibrotic, your face is not exposed to the bronchus, but that positive patient is coughing on your face. You are using a mask, but it doesn't give protection. But then the local bronchus will protect me from that infection. But other people may be healthy, but they don't have specific protection, immunity to deal with that infection. So what Dr. Kakadia said, and I am doing it, using it Methylene for another purpose, that I will talk to you after I discuss with Dr. Kakadia in next session. And not 2 years. Corona has come today, not even for TB, but we are taking it for since 3.5 years. That I will discuss with Kakadia in next session. Dr. Kakadia will present you my hypothesis, why I am taking since 3.5 years.
Okay. Is there any other question, or I will say, sir, we have talked lots about vaccine. So is Omicron specific vaccine needed? No.
No.
I think if this vaccine is giving us protection and minimizing the side effect of Omicron, so new variant come, how many times you will go on? Rather, I'll say some non-specific general immune booster, if vaccine can be prepared, that will deal with all the other viral infections. That will be better than specific one viral infection. So that will be, because we are expecting new variant also. So specific rather than specific, general, as I said, PPD we can give what I think that it will give local protection against the deal with the infection, like that evolved structure from which will deal with RNA as well as DNA immunity, that will give us long-lasting protection. T cell, if we can, the T cell also, so that can that will be more helpful.
Is there any question from the audience? So we can take up that question. Or you can, dear audience, you can put your questions in chat box. Okay, sir. So, sir, sir, one last question I would like to ask all the 4 panelists: is Omicron blessing in disguise? So, Kakadia, sir, I will start with you.
Yes, I agree with you that Omicron is a blessing in disguise, because for a person who is vaccinated, or for a person who had a previous natural infection, the Omicron infection is more or less like a common flu or common cold, almost like that. So that gives you a booster shot. And I came across several publications where they mention that the Omicron gives almost 26 to 27 times more number of memory cells produced, memory lymphocytes produced. So 27 times more memory lymphocytes produced means it will last, the identity of the adaptive immunity will last for more than 3 to 4 years compared to vaccine. which will last only 6 to 7 months. So that is one thing, that you are protected. Once you have Omicron infection, you are protected for 3-4 years. Number one. Protected, when I speak protected, not protected from the infection, but from the solidification of the lungs, complications of the typical wild virus. So that is one thing. And the second thing is that the vaccination in India, of course, it is very good that we have covered 160 crore shots. Almost like 100 crore have been given 2 shots and about 60 crore have been given 1 shot. But out of 210 United Nations member nations, no other country has achieved this. Most of the countries, for example, Pakistan, only 7% population has been given vaccine. They don't have even money to buy vaccine. They don't have vaccine of their own production, but they don't have money to buy it from us. Sri Lanka doesn't have money to take vaccine. They don't have even money to buy petrol from Gulf countries. They forget about vaccine. Bangladesh also. So most of the countries which are below poverty line in the world map, they are almost unvaccinated. And I don't think they are, I mean, it will take another 4 or 5 years for the entire world to become vaccinated. So if this Omicron infection is mild, like in India, in other countries also where there is not enough vaccination, that would work more or less like a nature's own vaccination to reduce the length of this pandemic. So I completely feel and agree that it is a blessing in disguise. And it's a very, very less expensive kind of infection. Compared to Delta, you would end up spending 6, 7, 8 lakhs rupees. घर में अगर 3 आदमी को हो गया तो आपका पूरा जिंदगी का बचत जो है वो गया उसमें. 3 आदमी को डेल्टा वेरिएंट इंफेक्शन हुआ, घर बार बेचना पड़ा, आपका पूरा बैंक बैलेंस साफ, आपकी गाड़ी भी बिक जाएगी और रिलेटिव्स फ्रेंड्स के पास से कैश पैसे इकट्ठे किए वो डेफ्ट में पूरा बाकी का जिंदगी आप जिए. For a family which had climbed to come above the below poverty line were dragged way below the poverty line by Delta infection. Whereas this infection is costing you only 1,000, 2,000 rupees, 5 days, 6 days of home rest, take vitamin C, vitamin D, methylene blue. So because there is no oxygen therapy needed, there is no complication. You don't need tocilizumab, you don't need remdesivir course, 1 lakh, 1.5 lakh रुपए उसमें नहीं डालना है. तो सस्ता है. So I mean, considering from all these aspects, yes, Omicron is a blessing in disguise, in my opinion. Golwalkar sir can give a better opinion.
No, yes,
He is a pulmonologist.
Blessing in disguise. Yes, I fully agree.
Right.
But let us wait and watch how long the immunoglobulins will last. Antibodies, how long it will last.
Right.
That we have to study. That only time only will tell us that this has given antibodies lasted for so many time, so much longer time. So that time only will come to know about. But I'll say that it is blessing in disguise.
So I'd like to add on this, but before that, Ira ma'am, please.
Yeah.
Unmute yourself, ma'am.
Ma'am, unmute yourself.
Now, I've got a different theory regarding the Omicron virus. It is years back I had read a book on being sick, getting better. Right? So now this theory is like this. Now we have also accepted the microflora in our large intestine. And we know that there are good and bad also. Right? So I feel that nature has created this Omicron variant to protect us from the variants like Delta or Alpha, which were dangerous and which were killing. And again, the virus wants to survive in the body, and to survive, it cannot afford to kill us.
Right.
Right. So both ways, probably we are heading towards a healthier future. People are very negative about things and they feel that things will get worse. We have to protect ourselves because we do not know what will happen. So we have to use Omicron, we have to use the lactobacillus, we have to use our other healthy microflora And we have to keep a healthy mind, where our hypothalamus and our parasympathetic system is well functioning, so that we can face whatever comes in the future. That is my philosophy. That is probably my theory. And that is why I'm keeping families together rather than isolating a patient separately when he or she is positive.
Right.
That's
Great.
my
That's
answer.
really great. Keeping families together rather than isolating is something which is really great philosophy. Thank you very much. It's really needed. Really needed.
Okay, sir. So, sir, thank you so much for such a wonderful presentation and taking up the as many questions as possible and giving different views and about the treatments. Even I always feel, okay, the name of the webinar was about methylene blue, but it is always important to have more treatment options, okay, apart from methylene blue, so that we can win this war against corona. So with this, I will request our promoter, Mr. Pranav Shah, to give vote of thanks.
Thank you, Doctor. And once again, thank you very much, Dr. Deepak Golwalkar, Dr. Kakadia, Dr. R.C. Shah, and Dr. Ira Madam for this very, very wonderful presentation. And I think this is the fourth or the fifth webinar I am listening to from these panelists. And every time I've found something new. I've learned something new. And this time, I think what I learned in this webinar was that now we have, as Dr. Kakadia rightly said, we have a trishul to fight COVID. So along with MB, methylene blue, now we have the hypertonic salt with UV rays, and of course this silver nanoparticles that can really fight the COVID. So I find these are very simple home remedies, cost effective, no side effects, and they can certainly sort of assure us and ensure that we can stay free from this COVID pandemic. Unfortunately, the government authorities and the regulatory authorities have been sort of giving a blind eye to this. But I hope that in the future, maybe this treatment of methylene blue can come into mainstream therapy treatment. Thank you once again. And of course, thanks to Dr. R.C. Shah for giving us that investment guidance to invest in silver, considering that it is going to go 4x and 5x, the value or the price, the cost of it is going to go 4x and 5x in a few years' time. Thank you so much. And the take-home message from Dr. Kakadia was very, very important. Take your vaccines. They are very, very useful, and they sort of stimulate your adaptive immune systems. I thank the panelists and the participants.
No, not stimulate, but train.
Train, sorry. Correct.
See, I would say that boosting your immunity is not good.
It's a double-edged sword.
It's a curse. Boosting your innate immunity, which is untrained and untamed, is a curse. You will end up with multiple complications with a hyper boosted immunity.
Okay.
It needs a training. So boosting the adaptive immunity and reducing the innate immunity, that is the thing which is actually necessary to prevent lung complication of COVID.
Thank you, Doctor. Thank you so much. Thank you, panelists, and thank you all the participants for making this webinar. I'm sure you found it very informative, very educative, and very important. And thank you once again for participating in this webinar. Thank you so much.
Thank you. Thank you, Golwalkar sir, Ira ma'am, Kakadia sir. Thank you so much once again. Thank you all the audience.
Thank you, Golwalkar sir. Thank you, Ira and Dr. Ramesh. Thank you very much.